To enhance understanding and raise awareness about sickle cell disease, the Sickle Cell Health Initiatives, in collaboration with the Ondo State Contributory Health Commission and other partners, has launched a sensitization and enrollment program for individuals living with sickle cell disease, offering them access to a free healthcare insurance scheme in Ondo City, Ondo State. The program, organized by Itote Joy Ifedayo Esquire, also aims to instill a sense of urgency in addressing the immediate goal of reducing the incidence of sickle cell anemia in the community. One of the key strategies highlighted is the importance of conducting genetic compatibility tests for future partners to help in preventing the disease. On the 21st of June, the Sickle Cell Health Initiative, in partnership with the Ondo State Contributory Health Commission and other collaborators, launched a campaign to raise awareness and enroll individuals living with sickle cell disease in a free healthcare insurance program at the Oba Adesonye Civic Center in Ondo Town, Ondo State. The program's coordinator for the Sickle Cell Health Initiative, Itote Joy Ifedayo, emphasized the need for more in-depth and strategic partnership with the Ondo State Contributory Health Commission, the Orange Health Insurance Scheme, and others to raise awareness and provide essential support for those living with sickle cell disease in Ondo City.
Okay, today's program is about sensitization, education, and awareness about sickle cell disease in Nigeria, in Ondo State, and particularly in Ondo City. Because we saw the prevalence rate of people living with sickle cell disease, and we saw that many people are not fully aware of the disease itself. So we decided to have the sensitization program. We've had it in Ondo, in Akure town, then we've had it in Ikare, then we decided to come to Ondo City this time around to talk to people about it, let them know what sickle cell is all about, and also the preventive measures, the management of pains and crises and infections in sickle cell. So these are the things that motivated us to come to Ondo City.
Meanwhile, the Special Assistant to the Governor on Health Matters, Professor Michael Odimayo, discussed the government's effort to address health-related issues for the citizens of the state.
As you can see, that the government of Ondo State is committed to the care of the people. That's one of the reasons why we are partnering with the Sickle Cell Health Initiative, to be sure that the program that we are having, that is the basic healthcare provision program to take care of sickle cell warriors. We are incorporating all the people into it so that they can have free healthcare services. This is a fantastic way to support them, and the state government will continue to do that, both from the primary healthcare level, secondary and the tertiary level. And we have also involved or engaged in massive sensitization, health education about prevention of this disease, that we can be able to take care of it. You will discover that the setup that the government has to be able to be sure that the primary healthcare are functional, this secondary healthcare in Ondo State now, by virtue of the restructuring of our teaching hospital, we have a proper, well-established secondary healthcare level that the people can get to and get attended to, and also we have the tertiary healthcare level that people can attend to. These are part of the programs that the government is putting in place to be able to be sure that our people are well taken care of.
Speaking at the event, one of the participants, a sickle cell warrior, shared the challenges faced by individuals living with sickle cell and suggested potential measures to prevent health crises related to the disease.
So I've faced quite a number of challenges as a sickle cell warrior. I've faced stigmatization as a sickle cell warrior, and that has been a big challenge to me. I faced across my milestones. I faced challenges across my milestone as a lady, right from childbirth to puberty to adolescence and to adulthood. There had been various challenges. I've had complications like numb chin syndrome. It's rarely spoken about in the sickle cell community, but it actually exists. I've had complications like cholelithiasis, and at the moment I also have a complication, hepatomegaly. So those are complications attached with sickle cell disorder, and people don't really talk about it. So I've had such complications, and I've also had to encounter stigma in the workplace system, which is something that I feel should be reduced at this level of awareness.
During the event, doctors reiterated that with proper self-care, sickle cell warriors can lead longer lives. They also mentioned that conducting genetic tests for partner compatibility can help reduce the incidence of sickle cell anemia in the society. Ian Elbong, Monday Uko, reporting for KAFTAN Television News.